And welcome to another episode of Add Water and Stir.
We're live?
We are live
Okay.
as promised. This morning's topic is about prevention, aka identifying sleep disordered breathing in children. This is something that is super important, a vital step of adding this to your practice, even if you don't see a lot of children in your office. Talking about it, looking for it, and helping a person live a long, healthy life from the jump is imperative. And with the information that we've shared with you guys so far, you are well equipped to start looking for this and talking about it in children in your family, children in your practice, parents, teachers, all of the above. So with no further ado, Dr. G, take it away.
Well, thank you, Nicole. I want to differentiate children from adults when it comes to sleep disordered breathing. I also want to make sure that when we finish today, you all have some take-home lessons so that you will know much better what to look for and how to at least begin to manage it. We won't get into management too much. Maybe we can do that on a subsequent talk. But first I want to differentiate between the adult summary for sleep apnea versus children. Adults, the trajectory for adults is typically obesity with comorbid conditions such as diabetes, high blood pressure, high cholesterol, things that we've talked about before and that you probably have read about. The main sign, or the first sign for sleep apnea in adults is snoring. Okay, that's oftentimes the chief complaint that we'll get with our patients that are coming in. Snoring, sleeping in separate bedrooms, etc. But really, is it the same for kids? And I guess that's what we want to talk about. So I'm going to give you a few statistics now, and I've got some notes so I won't forget any of them. First of all, sleep disordered breathing in children, they peak at an early age. They peak between 2 and 6 years old. So it's during the preschool years that this tends to be at its peak. Again, the main sign for this also is snoring, so that's something to watch out for. Also, you might include teeth grinding, that sort of thing, along with the snoring. It is characterized by apneas, but the difference between apneas in children and apneas in an adult is that for an adult to be considered positive for sleep apnea, they have to have 5 events per hour. For children, it's only 1 event per hour, and that's an abnormal reading, and that's an indicator that there is sleep apnea. The children will also exhibit signs of excessive daytime sleepiness, but oftentimes that manifests itself by poor behavior. Okay, these kids oftentimes get diagnosed with hyperactivity disorder. Okay, oftentimes they can be put on drugs such as Ritalin and other drugs for attention deficit disorder, attention deficit hyperactivity disorder. They tend to act out, and really the main reason is that they're not getting adequate sleep, and they're behaving badly because of that. And anybody who's had kids knows that when they're tired, they tend to act monkeys rather than just lay down and take a nap. Let's talk a bit about snoring. Okay. Studies in the pediatric literature show that benign snoring, and they call it benign snoring, can be chronic in 3 to 12% of children. Well, we need to bust that myth, okay? There is no such thing as chronic benign snoring. Chronic benign snoring indicates an airway issue and a sleep disorder that particularly needs to be addressed. We've talked about how critical it is in adults, but also in children. Benign snoring, quote unquote, has been linked to poor academic performance. Some studies show that even an up to 10-point reduction in IQ scores in children that have benign snoring. 22% of kids will have occasional snoring, and occasional snoring due to upper respiratory tract infection. fine. That's something that everybody gets. Your nose gets stuffed. You can't breathe. You end up having to breathe through the mouth. But we're talking about chronic snoring, and that's the issue. I did just allude to breathing through the mouth. You need to watch children's oral posture, and that's something that we want to stress and have you think about, and also start to observe when you're just walking around. Okay, what is good oral posture? Talked about it before. Lips together, the teeth should be slightly apart, tongue completely filling the oral cavity all the way up to the hard palate. Relaxed nasal breathing. Okay, that will then ensure or help to guide growth of the lower face and will result in permanent teeth coming in that are not crowded. Oftentimes, these kids rarely ever need orthodontics. They may have some maybe minor rotation or something going on that they may want fixed, but those are easy fixes. We can even do them with Invisalign now without having to retract teeth back into the face, which is a whole other story. So, some of the take-homes that you want to ask parents of young children in your practice is, first, does your child snore? Okay, that would be number one thing to ask. And then, as far as if the answer is yes, then you need to perform a proper oral examination. The first thing I'll look for is, we'll look down the throat. We'll look for obstruction. Typically, it'll be tonsils and adenoids. We can't really see the adenoids, but if the tonsils are enlarged and are blocking the airway, then you can assume that the adenoids are doing the same thing, particularly in a kid who mouth breathes. The other thing to look for are crowded teeth, crowded dentition in the deciduous dentition, in baby teeth. Are the teeth crowded? If they're crowded when they're children, then you know that there's not going to be enough room for them to come in as an adult, and you also can assume that there are issues with oral posture. Look at the arch form. Is the arch form a nice wide U shape, or is it a narrow V shape? V-shaped arches also are indicators of a poor airway. You think about the hard palate, it's it forms the floor of the nasal passage. And so if the hard palate is narrow and vaulted, that means that we've got a narrow tube, a narrow nasal airway. Narrow nasal airway predisposes to mouth breathing because a person can't adequately get an adequate air intake through a narrow nasal passage. Again, you evaluate the airway. You look for tonsils and adenoids. That can be done also radiographically, and certainly begin to talk about getting help for that, tonsils and adenoids, and then something called myofunctional therapy to retrain the oral posture can be life-altering for these kids. So, some of the take-home points that you just got to keep in mind is that sleep-disordered breathing occurs at all ages, not just adults, okay? There's increased airway resistance, and there is a partial or complete obstruction. Children can be susceptible to it just like kids. Now, you may have been told or heard that if you don't do anything about the tonsils, well, they will shrink and go back to normal. And they will. By the time a child reaches, teenage years, typically the tonsils will recede and they will be more of a normal size and not be causing such an airway obstruction. But by then the damage is done. And by not recognizing this problem early in life and taking steps to correct it, you are dooming a child to lifelong consequences, and you really have the power to change the child's life, to really make a life-changing difference, to help this child to avoid sleep-disordered breathing, obstructive sleep apnea as an adult. Okay, so other take-home points. You got to recognize it early. Okay, this starts in infancy many times, and so looking at airways when infants are old enough to be able to tolerate maybe a tonsil adenoidectomy might be the way to go. And communication. You've got to communicate this to the parents and be able to refer for appropriate treatment. There are specialist pediatric otolaryngologists, ENT surgeons. They specialize in pediatrics, making that referral. Finding an orthodontist or training you and your team to provide orthodontics that enhances the airway, okay? Airway-centric approach is what we're talking about here, rather than just trying to straighten teeth, because straight teeth don't necessarily translate into a quality airway. And then, again, ask that question, do you snore? So, Nikki,
Yeah.
that's about all I have. We want to keep it a little short this morning.
Great. Well, it's such a interesting topic that we would be more than happy to talk to anyone who is interested about. How you can find us online at our website, dentalsleepapneatraining.com, on Facebook at DSM Solutions, on Instagram at DSM Solutions CA. You can email us at info@dentalsleepapneatraining.com or give us a good old-fashioned phone call, 818-561-6715. Well, we will talk to you all next month for the next episode. Have a happy 4th of July. Get outside, eat some burgers, and we will talk to you later.